So family medicine doctors are specialists who particularly focus on holistic care of individuals as they are in their families, as they're in their communities. And so Malawians are 75 to 80% living in rural communities and villages. But we know that in almost every country, specialists really go to the large cities. And so it's really good to have these large tertiary hospitals where you have lots of specialists, but Malawi right now is suffering from a drain of all of our specialists are going to these hospitals in these cities, and you're left with 3/4 of the country doesn't have access to specialists anywhere close to where they live.
I think family medicine is very important for Malawi, and I can extend even for Africa for some reasons. Like in Malawi, it is rare to find specialists outside the teaching hospitals. So for 29 districts, we still need family physicians who will be working as specialists at the district level.
I feel that family medicine is important to the Malawi health system in a sense that if we are going to achieve universal health coverage, then we need to invest more in primary care, which means focusing on preventive health services and also promoting good health-seeking behaviors, and it all starts in primary care. We are trained to be able to tackle all conditions, kids, women, adults, geriatrics, and I was also able to be involved in the public health interventions at the district hospital. So it was a more fuller, broader view on medicine, and with time, it became more apparent that family medicine would be the right way to go with regards to furthering my career in medicine.
Family medicine program is very fascinating because one thing is we stay with the patient when they are born up to the time they are old, even when they die. So family medicine is the one that offers me a platform to give to the rural communities.
One exciting thing about being in family medicine is that this is a great specialty for you if you're easily bored doing the same thing over and over. So our family medicine specialists are getting trained not just to be able to deal with a patient on any age level, to deliver babies, to see geriatric elderly patients, to handle inpatient and outpatient emergencies, but they're also trained to be social advocates. They're also trained to understand and learn how to write protocols for hospitals, how to be leaders in management systems, how to advocate for their patients in a community level and in the hospital level. So it's an exciting field because there is so much of a holistic approach to how we train our family doctors to be leaders, whether they're going to be in private practice or whether they're going to be the district leader in one of Malawi's 28 districts.
When I started my residency in year 1, I started with surgery rotation. And as I was going through, the surgeons were like, "Sarah, are you sure you want to be a family medicine? Because you seem to be a surgeon more than a family physician." And I was like, "No, really, I would like to become a family physician." Now, we all cannot be the specialist for the other major things like all surgeons or obs and gynecologists. No, we cannot be. But for us to be able to reach out to the masses who live in the rural areas, then I would recommend that most of us should become family physicians. In that way, if we are to really serve our people from the grassroots, then we need more family physicians in Malawi.
And being in Malawi is really exciting as family medicine is developing because every single registrar who's coming up so far is a pioneer who's going to their district or their workplace, and they're offering services that no one who's come before them has been able to offer. And so to be a part of that training and to see the excitement that they have as they're venturing into these new roles is really rewarding.
As a doctor, you tend to see patients of all ages, from day of conception to the time the patient dies. I'm a person who like changing. So today I get excited with surgery. Tomorrow I'll be excited with maybe seeing a pediatric case. So That is quite exciting because you are not predicting whatever you're going to see every day or every time you are changing.
I would encourage my fellow medical officers that are trying to make a decision on which specialty to go to consider joining family medicine, because I find that it's a very fulfilling specialty. You feel good at the end of the day, seeing your patients get relief, and even hearing the feedback from the patients when you meet them. They will attest to how different you have handled them, how they have never experienced such kind of care before. When they come to a health facility, they will always question, why are you listening to my concerns? Why have you taken this time to actually hear what's bothering me?
As far as Malawi is concerned, this is the way to go. Family medicine is the future for Malawi.